Hi, this is Josh. I'm a pharmacist with pharmacisttips.com. I'm going to talk to you a little bit about if there's an Aggrenox generic substitute, and we're going to talk about the efficacy of Plavix versus Aggrenox. So first off, what is Aggrenox? Aggrenox is a medication, a combination of aspirin and extended release dipyridamole, and it's used to reduce the risk of stroke. It's dosed as twice a day. And in the United States, it is currently available as a generic. However, even the generic is often tier 4 or non-formulary, meaning it's not covered well by insurance. So what if we just split up the aspirin and the dipyridamole? We take them separately. Doesn't reduce costs. The single ingredient is just about as expensive as the combination product. And we've been having some supply issues with the single ingredient, so it may be difficult for your pharmacy to find. Also comes in a regular release or immediate release form, but you would have to take that 4 times a day. And the data just, there's nothing there to show that would be as effective. So you could increase your risk of stroke and increase the complication of your medication. So that one probably is not worth it. What is Clopidogrel, or it's generic for medications sold under the brand name in the US, Plavix? It's also used to reduce the risk of heart attack and stroke. A widely available, inexpensive generic is available, and most insurances cover this very well at a low copay. So what about uh, Plavix versus Aggrenox? Which one is more effective? Well, there was a study um, where they compared the efficacy of the two generic Aggrenox versus generic Plavix. What did they find? They followed them for 2.5 years, and so stroke reoccurrence in the Aggrenox patients was 9%, and in the Clopidogrel patients, 8.8%. So they determined the two treatments were similar. Neither one was superior. So they could be used, according to that study, they could be used interchangeably. So it seems the effectiveness is equal. Both seem to reduce the risk of secondary stroke equally. The interesting thing, clopidogrel may have a slightly lower bleeding risk, meaning bleeding in the stomach or colon, which can occur with many of these medications used to reduce the risk of heart attack and stroke, and cost savings. This I noticed this. My mom is going on Medicare Part D, and all the plans had generic Aggrenox on a tier 4. So we did some digging, and clopidogrel is shown to be just as effective. So switching to that will save her over $2,000 a year. And her doctor was on board with that, and so he changed that for her. Now that's a conversation you need to talk to your doctor about. They may have another reason that I didn't bring to light here to use Aggrenox, so it's a conversation you need to have with your doctor, and you can discuss the options available to you. Remember, you want to reduce your other risk factors that can lead to a stroke, such as blood pressure. Mind what we eat, get some sort of regular exercise. You can talk about those with your doctor um, as well. Medication is good, but if you can do some other lifestyle changes, that's even better. Appreciate it if you'd subscribe to the channel if you found this information useful. And as always, thanks for watching.